Hi, this is me, Dr. Aditya once again. As always, I have come up with a very important topic in examinations. For in USMLE examinations, you will land up with one or two questions from this topic regarding child abuse. So I'll be going through this, and I hope with this, it's a short topic. So I hope with this, you'll be able to solve most of the problems in your examinations in both USMLE and in NCLEX examinations. So moving ahead, if you feel that the speed of the presentation is slow, you can always fast forward it into speed in YouTube. So let's go ahead. So there are a few things we have to understand in from examinations point of view. There will be descriptions of where you feel the child is being abused, and then you have to call CPS, okay, Child Protective Services. Sometimes it looks like a fracture, but again there will be some descriptions like there is the multiple site fractures, and the fractures are healing at different times. So based on this, you have to find out this is not an ortho consultation, rather a case of child abuse, and again call CPS. So these are some of the common type of questions in examination. So now let's move ahead. Child abuse. As always said here, all cases of suspected child abuse must be reported to local child protective services. And now, neglect. Neglect is the most common form of child maltreatment, and neglect means it's not giving proper nutrition, not maintaining proper hygiene, and because of which there will be withdrawn effect. The child's emotional development won't be as good as it needs to be. So similarly, the child's social development won't be as good as it should be. The child will be emotionless and facious, and also there will be failure to thrive due to failure to provide adequate food, shelter, supervision, education, and affection. So this is neglect. So neglect is most common form of child maltreatment in which the parents cannot provide food, shelter, supervision, education, affection, and because of which there won't be good holistic development, and there will be failure to thrive, and the children will be socially and emotionally lagging in development, and there will be withdrawn. So these things needs to be cared, and similarly they will have poor hygiene. Next is physical abuse. This is another form of child abuse. Definitely in this case, there will be non-accidental trauma like fractures, bruises, burns in different parts of the body, injuries often in different stages of healing, and in pattern resembling possible implements of injury. So obviously there will, if a child falls or something like that, there will be chances of fracture. But how we differentiate it with abuse is that in case of physical abuse, the child will have multiple injuries in different parts of the body, and even if there is a fracture, the fractures are in different stages of healing. So this is a very important clue in examinations, different stages of healing. So based on this, and also there will maybe other bruises, burns in the body, okay, and based on this we'll say that it's a physical abuse. And a few other specific scenarios is like second baby syndrome, in which when a baby is vigorously shaken, there will be abusive head trauma. So that is physical abuse. And there may be subdural hematomas in the brain, and similarly retinal hemorrhage when baby is shaken vigorously. So these fall under second baby syndrome with head trauma, subdural hematomas, and retinal hemorrhage. So yes, and this is physical abuse, is another form of abuse. And another indication of abuse in examinations is that there will be delayed medical attention. Okay, caregivers delay seeking medical attention for the child or provide explanation inconsistent with the child's developmental stage or pattern of injury. So how do you differentiate in examinations that this is child abuse? You have to call CPS, number one, because there will be fractures or something like that in different stages of healing. There will be bones, different types of injuries, bones, fractures, and abuse, and bruises. Okay, and similarly, next hint is that caregivers delay seeking medical attention. Okay, they won't bring you to the child to the doctor unless it's like they fear the death of the baby or something serious. So for minor cases they won't bring. So these all collect up in the child's body, and there will be different stages of healing. So yes, so delayed medical attention is another hint. And critical statistics is that 40% of death related to child abuse or neglect occur in children less than 1 year of old. So these children, they don't speak, and often they can't speak. I mean, they don't speak, they don't reach out to other people, they don't walk, they remain in the same place. So most of the child abuse or child neglect leading to death occur in children less than 1 year of age. Next form of child abuse is, we talked about child neglect, next we talked about physical abuse, next is sexual abuse. So a child may develop STIs, UTIs, genital, anal or oral trauma, and yes, and based upon this we think that this is a sexual abuse. Okay, and most often there may not be any physical signs of sexual abuse, but then we have to put into consideration when there is physical abuse. Okay, this son may also have been gone through sexual abuse. We have to think of that, and not always. There may be trauma in mouth, anal or genital region, but there may be, and there may be STIs and UTIs too. Sexual abuse, another hint is that children often exhibit sexual knowledge or behavior incongruent with their age, and this is most common in children with 9 to 12 years of age. Okay, next form of abuse is emotional abuse, in which infant and young children are abused. Okay, so babies of young children may lack a bond with the caregiver. So babies or young children may lack a bond with the caregiver but are overly affectionate with less familiar adults. Okay, and they may be aggressive toward children and animals or unusual anxious. So in case of emotional abuse, which is common in children, younger children and infants, these children, they lack a bond with their parents or with the caregivers. But then if someone is less familiar, then they may so overly affectionate towards that people. So the normally the children will show their love, their affection, their attachment to the parents or to the caregivers. But in this case, instead of to them, they show the emotional attachment to the less familiar person. So okay, there may be something is not sinking in, right? So that may be a hint for emotional abuse in the children. And they may be aggressive towards other children. When they see the other children being loved by their parents, they may have some sort of jealousy, and they may be aggressive. And sometimes they may be aggressive towards the animals, and they are anxious as well towards the animals, because they will outpour, they will act out their emotions to the animals, and they may be aggressive towards the animals. Okay, so this is a sign of emotional abuse. So yes, when they're emotionally abused, they may exhibit angry outbursts, they may be socially withdrawn. So and there may be somatic symptoms, and so they may say that they have body pain, they have stomach pain, they have a headache, and for which there won't be any medical cause found. Okay, here's some statistics that 80% of young adult victims of child emotional abuse meet the criteria for greater than one psychiatric illness by age 21. So if someone goes through emotional abuse in their childhood, then in that case they may land up with more than one psychiatric illness by the age of 21. So almost 4 out of 5 such children who has undergone emotional abuse will develop have more than one psychiatric illness by the age 21. Next is vulnerable child syndrome. So in terms of child abuse, we talked about the child neglect, physical abuse, sexual abuse, and emotional abuse. The next topic we'll be talking about is vulnerable child syndrome. In this case, parents misperceive the child as especially susceptible to illness or injury. Okay, so this is something different from factitious disorder imposed on another. infectious disorder imposed on the parents. They impose the some injury to the child so that they can get a emotional sympathy from others. But in this case, it's not that they are doing something harm to the baby, but they are overly sensitive, and they always misperceive that the child uh, is susceptible to illness or some sort of injury, so they are more concerned with that. And in this case, most of the time the child in their past have gone through some serious injury, serious illness, or some life-threatening event, and because of that the parents are triggered that my child is vulnerable. Okay, so this is called vulnerable child syndrome. And because they think that they are vulnerable, the children is vulnerable, they that feeling, that very feeling of the parents may lead to missed school or some overuse of medical services. Okay, so this is called as vulnerable child syndrome, in which the parents are not doing anything bad, but because of their over misperception that the child may be susceptible to illness or injury, they become overly protective, and because of this they frequently visit the doctors even for the minor cases, they for the child, and sometimes they also lead to missed schools even when the child has minor physical, let's say minor headache. Then they may say, okay, you may be home, because they have that strong perception that their child may again land up in other life-threatening or some serious medical conditions. So that's why they become overly sensitive. So this is vulnerable child syndrome. So being too good leads to harm to the children. So here in this slide presentation, we talked about child abuse, we talked about neglect, physical abuse, sexual abuse, and emotional abuse, and finally we talked about the vulnerable child syndrome. So from these we will often see 1 or 2 cases in the examinations, so be prepared for that. If you have any questions, queries, please comment. See you in the next slide.